welcome back to Plastic Surgery TNA. That's Talking Advice, the podcast where I delve into the realities and complexities of plastic surgery. I am your host, Dr. Earl Stephenson Jr., and today's episode is a somber tale. It's entitled Untold Stories: The Dark Truth Behind a Plastic Surgeon's Fatal Operation. Let me set the scene for you. Would you operate on your family member if you were a surgeon? Would you operate on your wife? Would you operate on your kids? That's the age old question and pressures that we may be under directly or indirectly. These same pressures confounded the doctor we're going to talk about today. I'm going to introduce you to the Browns. This is Dr. Benjamin Brown, a plastic surgeon out of Florida, and his wife, Hillary. Dr. Brown is a board certified plastic surgeon in Florida. He operated on his wife in 2023. I believe that he's probably been doing procedures for her for a while. And I'm not going to sit here and tell you that plastic surgeons don't do that. There is a fine line to be drawn. But let's talk specifically about this case and why this case is different than the other side of the line of safety. Dr. Brown, in November of 23, decided to operate on his wife. And again, this is not her first operation and doesn't seem like it was her first operation with him. That fatal November day, Dr. Brown decided that he was going to liposuction his wife's arms. He was going to do some lip filler. He was going to make some adjustments to her ears. Maybe she had an ear pinning or an otoplasty. And he was going to revise a scar on her tummy. And from what I've read, do a mini muscle tightening. I don't really know what that means, but that's what was stated in all the media outlets that I read and from the indictment that I read. So, this is what was going to happen in his office. This was also going to be done not in a certified office surgery center with his wife being monitored for, anesthesia, making sure her vitals are good, making sure she's comfortable, making sure that everything's appropriate, especially for all those procedures. This was done in his office under, from what I can best tell, which was oral sedation and local anesthetic. There's nothing wrong, first and foremost, with oral sedation and local anesthetic. Plastic surgeons from here to Timbuktu do this all the time. But our judgment allows us or dictates or drives us to do these for very, and I hate to use this term, minor procedures or short duration procedures. Maybe we're going to take off a series of moles. Maybe we're going to do a little bit of a scar revision. Maybe we're going to do just a little bit of liposuction of a chin. Very reasonable to be done with oral sedation, local anesthetic, appropriate monitoring by the plastic surgeon with his or her staff. But when you're talking about doing arm liposuction, revision of a tummy tuck scar, for lack of a better term, and then some muscle tightening plus ear revision and lip injections, much too much for me as a board certified plastic surgeon to be done in my office, especially under oral sedation. Now, be that as it may, here's where it gets sideways. According to all the media outlets that I researched, It appears that Hillary Brown, the wife, injected something into her IV bag. It's yet to be determined what that was. Was it antibiotics? Was it medications for pain? Was it medications for sedation? No one knows, but she did that herself. And the caveat here, she's not a trained medical professional. On top of that, she took, as the outlet that I read most often, and I read many, she took a cauldron of pills. Again, it's really hard to determine which pills were taken, but we do know, according to the outlets, that she took Valium, which is a sedative. Again, nothing wrong with Valium, but there is no documentation of what she put in the IV bag and no documentation of what she took by mouth. So, be that as it may, Dr. Brown pushed off. Again, for me, doing a scar revision on the tummy in the office is really reasonable if that's all I'm going to do. So, you do the scar revision, tightening someone's muscle in the office under sedation by mouth or by pills with local anesthetic is not wise. So, this is the first critical, or no, I wouldn't say the first. This is a critical mistake. The first was probably, obviously, operating on his wife. The second was not documenting well as to what she was taking, how much she was taking. So I wouldn't tighten anyone's muscle in the office. And as I read, I kind of felt back when I read after he had finished the tummy work, he somehow encouraged her or allowed her to stitch up her own tummy incision. I don't really know how that's possible. He must have been working on her lips or ears at the time, but I just don't see how that's possible. Again, a patient, a patient, because that's what she boils down to. She's a patient. It's closing her own stitch line. An untrained patient. She's not a physician. She's not a dentist. She's not a healthcare professional. So, again, red flag number 500. The patient, which happens to be his wife, is closing her own incision. During that time, because he's numbing her up with what lay people call, or the public will call, Novocaine, which is what we call lidocaine, which is one of the groups or one of the types of local anesthetic, just like when you go to the dentist. She starts to feel a little loopy. And she articulates that to him, and she's kind of jumpy, and he notices that, I guess, but decides to press on. And he just continues to numb now the arms after he's numbed the tummy so that he can do liposuction of the arms. He numbs them up. He performs his liposuction of her arms, and she is really kind of drifting, not really super responsive, saying now that she kind of sees things, different colors in the room. Red flag, red flag, red flag. He blows right through that. I mean, just blew right through it. Decided to go on after he's finished with the liposuction of her arms to perform lip injections. I'm assuming with some type of filler like Juvederm or Restylane. During that time, she now goes from being a little jittery, kind of having some visual issues, to unresponsive. And she's seizing. Okay, you figure, all right, she's down. He's gonna stop and he's gonna do what he needs to do because this is a patient, which is bad, but this patient now is his wife, which is horrendous. Horrendous. She's unresponsive. Does he, at the urging of his staff, do anything? No. He does nothing. It makes it look like, from my understanding and my research, that he just try to plows on, and then she starts seizing, and he still doesn't do anything for upwards of 10 minutes. Upwards of 10 minutes. Finally, finally, after about 10 minutes or so, he decides to call 911. And for those not in medicine, which probably are many of you, your brain cannot survive without oxygen for 10 minutes. That's going to be a no go moving forward for anyone who has oxygen deprivation, a lack of oxygen for 10 minutes. So finally, 911 arrives. It's called, rather. The emergency personnel are dispatched, and they go to the office and they bring her to their local hospital, where she's placed in the ICU, which appears that she was. She's given, tremendous multi-system organ support, and she's basically brain dead. And about after a week, they decide to take her off life support, and she dies. She dies. Dr. Brown's wife dies. So the question is again, as a plastic surgeon, would you operate on your wife? The answer is no, you wouldn't, but we do, and some people go further than others. The question is going to be, have I operated on my wife? No, I have not operated on my wife. Have I done some local skincare for her? Of course. Have I done some fillers here and there and some Botox? Yes, but I'm not going to operate on my wife. There is an ethical duty, I guess it's the lack of a better term, that I think needs to be digested. You just don't operate on family. Murphy's Law is in full effect. There are a lot of critical decisions that need to be made during an operation. When you, or let's say if I did it, as the plastic surgeon, operates on a loved one and it's your spouse, you lose all objectivity. So that's red flag number one. You have poor judgment. Now we harp, and I especially harp, and we as especially harp, that you need to be board certified, board certified, because it shows that you have good judgment. Even despite this, you can have people who lose sight of their judgment. So, you as the consumer, if you hear stories about this, or you believe that this is a problem because you've heard that he or she, the plastic surgeon, may have operated on their spouse or their wife, you might want, just in the back of your mind, not as a singular event, flag that. Just me talking, because it points to judgment. That's not good judgment. You cannot be objective about what the steps are to get the patient, i.e., the wife, from start of the operation safely into a recovery room, safely recovered months later, and living her life. You will want to do everything and anything to make it perfect, which eats up time, more anesthesia time, more local anesthetic, more, as I call, diddling about things that are good but not perfect. Nothing's perfect. Everything is great. And when you get to that point, stop and move on. But when you have your wife, you don't move on. You keep nitpicking and nitpicking and nitpicking and nitpicking. And that nitpicking leads to hours. And that extra set of hours is not going to make the outcome better. Obviously, you can potentially make it worse, because if you're doing it on the local, you're adding more local, more Novocaine, more lidocaine. which can lead to problems, which we'll talk about here in a second. But you can't make the critical judgments that are necessary. So that's number one. I don't have a problem with sedating people, as you heard me say before, by mouth with pills, but you have to treat your wife, if you're going to do it, like a patient. You got to follow the protocols of safety. You have to make sure that they are in good health. You have to make sure that you know what you're giving them and how much. You have to document that. And if there's trouble, you need to manage that and have protocols to manage that. For potential customers, clients out there, patients, when you talk to your plastic surgeon, ask if he or she is certified in advanced cardiac life support. Now, none of us want to use that. A lot of us have used that when we were training because we train in general surgery and plastic surgery at big trauma centers, which require a lot of intensive medical practices on a daily basis. In a local office, during cosmetic surgery on healthy patients, we don't typically need that skill set, but we have that skill set and we are certified every 2 years for that. You need to ask that. You need to ask that the staff has basic life support training. I know these are scary questions, but you just need to know. So you need to know that. In regard to Novocaine or lidocaine, the local anesthetic, you just can't give it till the cows come home. You just can't do that. As my mom always say, you just can't. So his wife, in my opinion, subsequently really died from overdose on lidocaine. She had the classic symptoms. She had slurred speech. She eventually had seizures, which is kind of the next step up if you want to use it or look at it like a ladder. And then finally, she had cardiac arrest. Her heart and lungs failed. And so, as practitioners, giving people local anesthetic in typical doses, like if you're going to numb up a mole, or in very dilute doses, like you're going to do liposuction, there are limits and maximums to how much you can give. And those need to be those maximums need to be calculated so that you don't cross that threshold. And if you're bumping up against that threshold and you're not completed with your said procedures, then you got to call it a day. It's a wrap. We got to finish this up and we got to pivot and make another plan, which probably means you have to go and have general anesthetic. So he failed to acknowledge. He recognized, I'm sure, not in his head, but he recognized, but he failed to acknowledge lidocaine toxicity in his wife. So a critical mistake. And because it's his wife, when she did have cardiac arrest, and again, I'm not in his head, I can only imagine maybe the immediate horror, of course, but the immediate embarrassment if he calls for help. So I'm going to say that's what was the delay was all about. He's got it. He's just going to keep it under control. He's got it under wraps. He can't let this get outside the office. And so he hesitated. And that really proved fatal because she went quite a duration without any oxygen to her brain. So again, he lost his objectivity. Can't do it. Can't do it. Don't put yourself as the plastic surgeon, or I'm going to flip it, even as the family member, don't put yourself in that position. Don't put undue direct pressure or indirect pressure by innuendo on your plastic surgeon spouse. It just never really works out right. So here we are. She's no longer here after Thanksgiving. So they have children. Now their children, they, they don't have a mom. And now dad has been charged, legally charged, with homicide and negligent manslaughter. And so he may go to jail. So effectively, those children have lost both of their parents because of a decision concerning elective surgery that was performed in the wrong environment on the wrong patient with the wrong treatment plan, too many operations or procedures. It was a series of failures that led to death. So, this is a very tragic lesson indeed. I don't think I need to emphasize that any more than I have emphasized it. It really underscores the ethical implications of operating on our loved ones. We need to adhere to our medical protocols and our medical ethical protocols and treat our family as patients. If your family member needs a mole taken off, maybe that's okay. If your family member wants a mommy makeover, maybe that's not okay. And you send them to your best buddy who you know can do the job. And you can do the job that's most critical at that point is you can be the supporting spouse. That's your job. So, interesting story, but horrifying story. I like to hear your takes on it. Should a plastic surgeon operate on his or her wife? Should a plastic surgeon operate on her husband? If you were a spouse of a plastic surgeon, would you want to have something done? I would love to hear your comments and leave them below. It's good discussion. So let's toss that out there. If you were a spouse of a plastic surgeon, would you want to have them perform your major surgery? So, on that note, I hope you've enjoyed this second episode of Plastic Surgery TNA Talking Advice. I thank you for joining me on this difficult journey this week. But next week, we're going to flip the script and we're going to get out of this and we're going to talk health and wellness again. I'm efforting of having a fitness a trainer and wellness expert on next week. So she is going to talk about exercise and how that fits into your plan for a healthy lifestyle overall, how that fits in if you're going to have plastic surgery, how that fits in if you've had plastic surgery. So I think she's going to bring some fantastic insights. I've known her for, gosh, I don't know, 10 years, 15 years, because you know what? She used to be a surgical technologist, which means she used to work in the operating room and she would help me with operations. So she's pivoted many years ago and taken a different route and has become a personal trainer. And I think her insights would be interesting. So if you're interested in that, then tune in next Saturday. I'll have more information during the week about that. If you like this episode, please share it. It really will help me grow this channel. I will be back next Saturday. So until then, peace.